PUC would like to advise you of a traffic restriction on Second Line West and Gooley Avenue. Teams are repairing a broken water main there on the south side of Second Line West. During the project, the eastbound lanes of Second Line West in front of Northern Credit Union will be reduced to a single lane while crews conduct repairs. This traffic restriction is necessary to ensure the safety of repair crews as well as the traveling public. Police are looking for a man who started a fire at a New York City gas station, a blaze that seriously injured a man nearby. It was reported around 2 a.m. yesterday at a gas station in Staten Island. The New York Police Department released video showing a man filling a gas can, then spraying fuel around the pump, setting a piece of paper aflame and using it to ignite the spilled fuel into a blaze that flared up around the gas pumps. Police say the gas station's fire extinguisher system put out the flames, but a 21-year-old man suffered internal injuries. He's hospitalized in serious but stable condition. The NYPD says the man who started the fire arrived in a blue minivan. Ontario joined the international community to raise awareness of human trafficking and make it clear that this heinous crime will not be tolerated in our communities. Minister of Children, Community and Social Services Lisa MacLeod said a lot of Ontarians would be shocked to learn that girls, women and vulnerable people are being abused and exploited by human traffickers right here in our own backyard. While this is an international problem, it is also a local one. MacLeod added that 2/3 of the cases reported across the country each year happen right here in Ontario. Human traffickers control victims through threats, violence, psychological abuse, and drugs. Ontario works with hundreds of partners across sectors that are committed to ending human trafficking, helping survivors, and bringing offenders to justice. MacLeod said that government remains committed to working closely with police, child welfare, educators, Indigenous partners, and social services and housing providers. A new study by the Fraser Institute finds a typical Canadian family of 4 will pay $12,935 for health care in 2018. Most Canadians are unaware of the true cost of health care because they never see a bill for medical services and may only pay a small public health insurance premium tax. And because general government revenue, not a dedicated tax, funds health care, it's difficult for Canadians to decipher how many of their tax dollars go to our public health care system. Using data from Stats Canada and the Canadian Institute for Health Information, the study estimates that the average Canadian family, so 2 parents, 2 children, with a household income of $138,000 will pay $12,935 for public health care this year. After adjusting for inflation, that's an increase of 68.5% since 1997, the first year estimates could actually be calculated. For single Canadians, health care costs more than doubled over that same time period from $2,115 in 2018 to $4,640 this year. Across the income spectrum, Canadian families pay vastly different amounts for health care. For example, the 10% of Canadian families with the lowest incomes will pay $496 for health care in 2018, while families among the top 10% of income earners will pay $38,903. The Deputy CAO, City Clerk Malcolm White, announced that a couple of school board trustees have been acclaimed. Jennifer Sarlo will stand as trustee in Ward 1 for the Algoma District School Board, and Suzanne Salaturi will continue to work with the Conseil scolaire de District catholique du Nouvel-Ontario. The Manulife Financial Insurance Company says it will launch the first medical marijuana program in Canada this fall in conjunction with Shoppers Drug Mart. Manulife says the program will be available as an option for participating group and individual health insurance plans. Under the partnership, Shoppers Drug Mart pharmacists at an Ontario-based patient care centre will help approved customers navigate the different strains of medical marijuana and the different ways to take it. Manulife customers will then be able to choose treatment that is covered under their Manulife plan and receive ongoing case management. The insurance company, which was already offering medical cannabis coverage to clients on a selective basis, says more details of the program with shoppers will become available once the program takes effect. Canada's Veterans Ombudsman says that while the federal government has implemented a number of his recommendations over the years, veterans are still facing difficulty accessing some benefits and services they've long been entitled to. Guy Perron released his 2018 report card today, detailing the government's response to recommendations made by the Ombudsman's office over the past 10 years. Perron says that progress has been made on the veterans' file since his update last year, adding that the government has actually addressed 72% of his recommendations, or 46 out of 64. Perron says the most important recommendations of the remaining 18 left untouched include ensuring that veterans are being reimbursed for treatment expenses under the Veterans Wellbeing Act, and that reimbursement is retroactive to the date of the original application, like it is under the Pension Act. Another recommendation encourages the Liberal government to amend the Veterans Wellbeing Act to allow a single Canadian Armed Forces member with no dependent children to designate a family member to apply for and receive the death benefit. Perron says he will keep a close watch on the government's actions and the remaining recommendations. Justin Trudeau says the funeral for Toronto shooting victim Reese Fallon brought back memories of the service for his brother Michel, who died at 23. The Prime Minister was in the city's Greek town yesterday to honor victims of the attack.
On a personal level, it was 20 years ago this year that we had a memorial service for my little brother who passed away in 1998, and seeing the young people there in that room who were so much like Mishi's friends 20 years ago, I just wanted to tell them that they were going to be remembering and celebrating Reese throughout their lives. I mean, still today, people come up to me who went to camp with my little brother, who remembered how he touched their lives in different ways. And I just wanted to tell those young people and everyone who is grieving and mourning that our loved ones, particularly extraordinary, beautiful ones like the two girls we lost, will be with us forever and will remind us that we need to work hard to honor their memories, honor their love, and their spirit, and we will do that, all of us together.